Today, we're diving into a really big shift in how we get mental health care. It's called telehealth psychiatry, and it's basically technology that brings the doctor's office right to you, no matter where you are. So let's break down exactly how it works.
Seriously, just think about that for a second. What if there was no traffic to deal with, no stuffy waiting rooms, just top-notch mental health care from a place where you feel completely at ease? Well, that's the core promise of what we're talking about today.
So, what is this stuff, really? At its heart, telehealth psychiatry is just using secure technology, like a video call, to deliver essential psychiatric care. We're talking everything from getting an initial diagnosis to managing your medication, all done remotely. It's real clinical care, just delivered through a screen. But, and this is a big but, it's so much more than just FaceTiming with a doctor. For this to be safe and truly effective, there are some really strict standards and protocols that have to be followed. So we're going to get into the weeds and break down what it really takes to do this right.
Okay, Section 1, the new doctor's office. First things first, let's talk about what you actually need to get set up.
The good news here is the tech you need is probably stuff you already have. A phone, a computer, camera, mic, check. But the really crucial things on this list are a secure internet connection, so definitely not the public Wi-Fi at your local coffee shop, and finding a quiet, private space where you can actually talk freely without anyone overhearing you.
And speaking of privacy, this is absolutely non-negotiable. Laws like HIPAA legally require that every single session happens on a secure, encrypted platform. This is a huge deal. It guarantees that your personal health information is just as protected as it would be if you were sitting in a physical doctor's office.
And this really is the million-dollar question, isn't it? I mean, if the doctor isn't physically in the room with you, how can they possibly guarantee high-quality care? And, maybe most importantly, keep you safe?
So let's get right into that. Section 2, Safety in the Digital Room. This is where we look at how the best providers maintain incredibly high standards, because this is where the real substance of telehealth really shines. Any good telehealth provider will run through a strict safety checklist at the beginning of every single session. They'll ask you to confirm your physical address, and no, it's not for tracking you. It's so they know exactly where to send help if, God forbid, a crisis happens. They'll also make sure you both have a clear backup plan in case the video call suddenly drops. And this quote from our source material just says it all, doesn't it? A well-designed telehealth program has these emergency plans baked right in. Just because there's physical distance doesn't mean you're ever disconnected from real, immediate help. Now, treatment isn't some set it and forget it kind of deal. A good provider is going to regularly review and recertify your treatment plan. And I just love this analogy they used. It's like a lifeguard who has to keep renewing their skills to prevent what they call symptomatic submersion. It's all about being proactive to keep you healthy.
Okay, and listen up because this is a critical legal point. The psychiatrist or nurse practitioner has to be licensed in the state where you are physically sitting during your appointment. It doesn't matter where the doctor is, it's all about where the patient is. This is the law, and it ensures they're fully accountable for your care.
All right, Section 3, choosing your provider wisely. Look, with telehealth blowing up, a ton of new online services have appeared out of nowhere. And trust me, they are not all created equal. So let's talk about how you can spot the difference. And that brings us to a really important comparison. We've got to be able to tell the difference between comprehensive, high-standard telehealth psychiatry and, well, those more minimalist online services that sometimes cut some pretty dangerous corners. Just look at this table. The differences are stark. A high-standard provider does a 45 to 60-minute deep dive clinical interview for your first evaluation. The other guys? Maybe a 10-minute text chat. Think about the risk of misdiagnosis there. Or look at the provider's credentials. A board-certified psychiatrist versus maybe some unverified coach. And the prescription policy. One is based on rigorous medical need. The other is basically on demand. These are the red flags you need to watch out for. So, now that you know what to look for, how do you actually put it into practice? How can you feel confident that you're picking a provider who really meets these high standards? And that leads us perfectly into our final section. Is telehealth right for you? Consider this your personal action plan for getting started the right way. Here it is, your step-by-step guide. It starts with the practical stuff like calling your insurance company. Then it's all about vetting your provider. Make sure they're board certified and licensed in your state. After that, you'll go through the standard clinical process, filling out detailed intake forms, having that really comprehensive first evaluation, and then setting up prescriptions and follow-up appointments. Now, let's talk about that first step,
Insurance. The great news is that a huge majority, we're talking around 90% of major insurance companies and government programs like Medicare, are now covering remote mental health care. But, and this is key, you should always call and confirm the specific details for your own plan.
You're probably wondering about prescriptions, right? It's a super common question. And the answer is yes. After a proper and thorough clinical evaluation, psychiatrists can absolutely prescribe most medications remotely. Now, there are a few exceptions for certain controlled substances, which might require you to pop in for an in-person visit every now and then to follow the rules.
Okay, but what happens if your Wi-Fi just dies mid-session? It happens to all of us. Don't worry. Any professional telehealth service will have a backup plan ready to go. Usually, it's as simple as them calling you on the phone to finish up or reschedule safely. You're not just going to be left hanging, I promise.
So when you boil it all down, here's the real takeaway. The future of mental health isn't only about discovering new treatments, it's about creating brand new ways for people to actually get that treatment. By knocking down huge barriers like travel and time off work, telehealth is opening the door to care for millions of people. The only question left is, are you ready to connect?